This video was prepared as part of the course requirements for Human Anatomy at Saddleback College. The hip joint is one of the body's largest joints and is a major weight-bearing joint. The hip joint is a ball and socket joint. The head of the femur, or the ball, articulates with the acetabulum in the pelvis, or the socket. The hip joint is a synovial multi-axial joint. A synovial joint is characterized by a joint cavity, ligaments, and an articular capsule. Multi-axial describes the joint's movement as it is a joint with angular movement in all directions combined with pivotal rotation. The part of the femur that articulates with the pelvis is the head of the femur. The femur is the longest bone in the body. The femur is also the only bone in the body that has trochanters. The greater and the lesser trochanter of the femur act as ligament anchoring points for the joint. The pelvis is made up of three different bones: the ischium, the ilium, and the pubis. All three bones form the acetabulum, which is the socket on the lateral pelvis. The head of the femur articulates with the acetabulum of the pelvis to form the hip joint. Cartilage lines the acetabulum to protect the bones from rubbing against each other, causing friction and making it painful. Since it is a synovial joint, the hip joint also has synovial fluid, which is both viscous and sticky. The combination of synovial fluid and cartilage makes the joint extremely slippery. The synovial fluid allows the joint to move under great pressure without wearing out the joint quickly. Muscles attached to the hip joint allow the joint to move. Almost all muscles located in the thigh attach to the hip joint in some way or another. On the posterior side, the gluteus maximus, gluteus medius, semitendinosus, biceps femoris, adductor magnus, and semimembranosus all span the hip joint and attach to the pelvis and the femur. From the lateral view, the tensor fascia lata and the sartorius attach to the hip joint. From the anterior view, iliopsoas and pectineus span the hip joint as well. There are only 3 ligaments spanning the hip joint, but the 3 ligaments significantly increase the stability of the hip joint. These 3 ligaments are the iliofemoral, the pubofemoral, and the ischiofemoral. The iliofemoral ligament is the strongest ligament in the body. The pubofemoral and iliofemoral ligaments can be seen from the anterior view, while the ischiofemoral can be seen from the posterior view. The hip joint has many different nerves that are included in the joint, but there are 4 main nerves. The 4 nerves are the femoral nerve, the lateral femoral cutaneous nerve, the obturator nerve, and the sciatic nerve. The sciatic nerve is the most noticeable nerve in this diagram located in the joint due to the size. The sciatic nerve does not run the entire length of the leg, but the branches off of this nerve do. These branches of the sciatic nerve also continue down the back of the calf and onto the foot. The combination of synovial fluid and articular cartilage make the hip joint 3 times more slippery than skating on ice, 4 to 10 times more slippery than metal on plastic hip replacements, and more than 30 times more slippery than metal on metal with the aid of a form of lubrication. This allows the joint to move more freely, creating less friction, and the wear of the joint is slowed down. The amount of stress the hip is under while a person walks can be up to 5 times the person's actual body weight.